Welcome to Marta. This week is Heart Health Week, and I'm here today with cardiologist Dr. John Rivers to learn more about how our tickers work and the new ways Marta specialists are now helping to prevent and treat cardiac disease. There have been incredible medical advancements in cardiac care in recent decades, with an 80% drop in the death rate from coronary heart disease since the 1980s. But there is still more we can do. And Dr. Rivers, the director at Queensland Cardiovascular Group, is going to explain this a bit more. Thanks for joining us today.
It's a pleasure to be here.
Now, we all know that weight and diet and other lifestyle factors impact our heart health, but why aren't we doing anything about it? Why isn't it changing?
Well, I think your question actually captures the essence of the problem, Jillian. 80% of Australians don't exercise enough, and 2/3 of adult Australians are overweight, and half of those are actually classified as obese. And that's all been increasing dramatically at the same time that the heart rate, or the heart death rate that you were describing, has been reducing. So you've got to say, if we know that that's the problem, why are people not fixing it? And I think the answer is we're not giving them the tools to fix it. The old-fashioned idea that you perhaps went to your doctor once a year and he said, oh, go and lose some weight and do some more exercise. We know that just doesn't work because Australians aren't doing it. So we need programs to help them modify the risk factors and to actually supervise them through the process.
Give them the support they need.
Yes, and give them some tools to do it. And to some extent, that is partly what cardiac rehab does for the patient group who've had a disastrous event like a heart attack or a stent or a bypass. But perhaps some of those tools could be extended to the general population. We need to be moving to prevention rather than simply treating after the events.
So early intervention would be important. So then how do I know if I've got coronary heart disease? I mean, usually, as you said, you would turn up to your doctor saying, I'm not feeling well, but how do we prevent it earlier?
Well, there are a lot of new tools. Traditionally, you would wait until you had symptoms, chest pain or shortness of breath or inability to exercise, or if you turned up with a disaster like a heart attack. But in practice now, there are ways of assessing your cardiac risk which are becoming more powerful. So there are all the traditional measurement of risk factors, but now we have tools like calcium scores and CT coronary angiograms, which will pick up developing plaque burden at a stage before perhaps you have any symptoms. And of course, that's the ideal time to be delivering interventions that might actually stop you from ever getting to the stage of having symptoms and events. And we need then to have programs that will deliver effective intervention early.
With the passing of people like Shane Warne, which was a very, very public and it affected a lot of people, issues with his heart, how do those kind of incidents affect people coming to see you and the questions that they ask?
Look, they definitely raise awareness, although I think it is often a transient impact. So yes, there would be a burst of people coming to ask the question, am I at risk after that sort of event? But we know really from, say, education programs about chest pain that you need to reinforce messages that those transient effects have some value, but unless you're continually delivering the message, people forget. Rather than simply have a pattern where we have high-profile people dropping dead regularly, it would be better to have programs that reinforce this and deliver the tools to change.
So when you do need treatment, heart surgery has become much less invasive for many cardiac conditions, and there's a larger focus on patients participating in post-operative rehab programs. What kind of rehabilitation is available for heart patients?
Well, that's a really good question. If I can take you back a little bit to the start of the journey that you were describing, when death rates were much higher in the 1980s and 90s, that's when cardiac rehab programs were designed. And it's hard to believe now, but the treatment then for a heart attack was several weeks bed rest and then 3 months off work. The program, of course, has evolved to the point where most of the time these days you'd have a stent or occasionally a bypass, and people are often back at work 48 hours later. So if you think about the structure of a cardiac rehab program, which is 6 weeks or longer of going to the hospital 3 or 4 times a week, that just doesn't fit into the modern lifestyle and the modern treatment paradigm. So we need to deliver programs now for patients that are structured to fit the way they live. They need to be able to be delivered remotely, they need to be delivered digitally, they need to be engaging, and they need to utilise all the new tools.
Well, how are you doing that? And can you explain a little bit more detail how that's actually possible?
Absolutely. So you can measure the failure of the existing programs to some extent by uptake rates. And only about 20 to 30% of people who are going to benefit from rehab actually complete it. And that's not to criticise the face-to-face rehab programs. There's a definite niche for those and we should continue them. But we need to deliver the rehab in different ways. So many patients don't live close to a major hospital rehab program, so the idea of 18 or 20 visits is simply impractical. Many people go back to work very quickly. There are groups who culturally don't like the idea of the group participation. There are patients with body image issues who also don't like the idea of exercising in groups. And the socioeconomic groups who are simply not able to attend. So remote delivery becomes key. And hybrid programs, of course, for some people who want to do some face-to-face and some remote. And what we need is not what I would call wellness apps, but what are really digital therapeutics, programs that allow your clinical team on one side to connect with the patient, but not by the patient turning up at the hospital. So the Queensland-based company CardiHab have built a digital rehab program that allows you to deliver tasks to the patient on a day-by-day basis, but also to digitally monitor all of their activity, blood pressure, weight, steps, walking speed, incredible technologies now that allow these interactions. And the clinician can watch it remotely and then interact by video conferencing at appropriate times. You can deliver education interventions, videos through the platform that you can direct the patient to at appropriate times in the course. And it's really quite an engaging process, and uptake rates with that sort of offering have at least doubled.
It's remarkable, isn't it? And so much has changed possibly since you began your career.
Oh, everything's changed since I began my career. I'd say 90% of the things we do now probably didn't exist when I started in cardiology.
And a final question just on that. Incredible discoveries in your lifetime to improve the longevity of people with cardiovascular disease, including heart transplants, pacemakers. Then on that, what's next? What's the next frontier?
Well, I'd probably, given that's a fairly wide-ranging question,
It's blue sky thinking. Anything you think.
Well, the easy answer would be to say genetic profiling. So at the moment when we treat blood pressure or some particular problem, we know the medications in general work, but in individuals there can be different levels of efficiency and also different levels of side effects. The ability to come to a clinic and point at you and say, well, this one will work for you and this one won't, will be important. But I would also answer it by saying I think that the system of care will be very different, and that may enable tools like that to be much more effectively used. So one of the strategies for the MARTA is to extend our care patterns beyond the hospital boundaries, to be with people in their homes, either physically or digitally or both, and to really care for them lifelong. And 12,000 Queenslanders start their healthcare journey in MARTA hospitals as babies, and we really want to care for them lifelong, and that doesn't mean just when they come to hospital when they're sick. It would be nice to actually stop them from actually ending up in hospital by preventing these diseases.
Indeed. Dr. Rivers, thank you so much for sharing your knowledge and experience with us. It's been great.
It's a pleasure.
Mater has state-of-the-art cardiac care services as well as leading clinicians who specialise in the prevention, treatment and rehabilitation of heart disease. If you'd like further information about how to keep your ticker strong and healthy, head to the Mater website at mater.org.au. Have a happy Heart Health Week, and I'll see you next time.